On Health Matters Television for Life, protecting the skin you're in. At age 81, this man is on a mission to let people know about the dangers of skin cancer.
If I were you, I would make an appointment.
How his battle with melanoma is inspiring others to take precautions. Plus, skin health from normal aging to treating rashes and acne.
Stay healthy.
Right now on Health Matters.
Health Matters is made possible by our viewers, the friends of KSBS, and by Providence Healthcare.
I'm Dr. Andrew Boulay, and when my wife had a cardiac arrest, I chose Providence because I knew that everything we needed for her complex care was available, from the emergency room to radiology to the nursing staff to the specialists we needed for her care.
My name is Beth Perez, and I am a registered nurse, and I work at Holy Family Hospital on the labor and delivery unit. I'm about to have my second child, and I chose Providence because I love and trust the people that I work with, and why wouldn't I seek care from people that I love and trust?
Good evening, I'm your host Teresa Lukens, and welcome to another edition of Health Matters. Monday marked the first day of summer, and that means more time outside for most of us. While the sun's rays are appealing, they're also dangerous. And tonight, we're going to examine skin health, from normal aging to skin cancer and everything in between. And here to answer your questions is our panel of experts. Dr. Joel Sears is with Advanced Dermatology and Skin Surgery Center. His practice centers on skin cancer and facial surgery. Dr. Philip Werschler is with Spokane Dermatology Clinic. He teaches at the University of Washington, serving as an assistant clinical professor in medicine and dermatology. Dr. Brett Gurley is with Rockwood Clinic's Cancer and Blood Specialty Center. His specialties are oncology and hematology. And finally, Dr. Benjamin Hsu is with Northwest Dermatology. He is an associate clinical professor of medicine at both the University of Washington and Washington State University. And as we mentioned, we will be happy to take your phone calls and emails this evening on the topic of skin health. We're also talking a great deal tonight about skin cancer. And I want to start with skin cancer tonight because it is summer. We're going to be spending more time outdoors. And Spokane is among the top 5 cities in the U.S. for skin cancer deaths per capita. Idaho also has a high melanoma rate. And Dr. Hsu, we were talking earlier about why this is. I think that might surprise people to find out because we're not exactly the sunshine city. Why is that?
Yeah, some people think that because we don't get as much sun here in the Northwest, when there is sun, people go out and splurge in the sun. They're indoors throughout the winter. Finally, when the sun comes out, people take advantage of it and go out and get burned. Another reason is that on very cloudy days, a lot of people get fooled into thinking that there's not much sun, it's overcast, it's cloudy, and so it's okay to go out without any sunscreen. And they don't realize that the UV light does penetrate through the clouds, and you can get sun damage even on a cloudy day. I used to practice in California and saw a number of skin cancers, but the number of skin cancers here, including melanoma, it was surprisingly higher than when I was practicing in California. There are also a lot of outdoor sports, outdoor activities that are available to people in this region.
And you're personally seeing more skin cancers?
Absolutely, absolutely.
I think another reason may be that skin cancer is more prevalent in people with fair skin, very redheads, freckled skin, that sort of thing. And then the population in Idaho and Washington, of course, is predominantly white and Caucasian, and that may be another reason why we see such a high prevalence of skin cancer here in this area. Mm-hmm. And then I think everyone loves the outdoors too. It's just an area where they have outdoor recreation and they love to spend time outside. And like you said, even if it's cloudy, you're still getting 80% of the sun damage through an overcast day. So.
Do we tend to ignore the signs also of skin cancers?
Well, certainly we can. I'd like to add one other point, and that is the cloudy inland Northwest is known for vitamin D deficiency. And low vitamin D levels they appear to be associated with an increased risk of skin cancer and a worse prognosis if you do get skin cancer. And because vitamin D is the sunshine vitamin, people think that as soon as the sun comes out, they have to go outside and bask in the glow of the sun to make their vitamin D. And as Dr. Xu said, they sort of take advantage of all the sun and don't think about it like people that live in Southern California or Arizona, where the sun is just out there every day and it's really your enemy and it's going to be there tomorrow. You know, here, like this season, we're having, as the paper said today, our summer season in reverse. We had the hot weather earlier, now we're cooling off as summer approaches. And I think Dr. Sears' point is spot on. We live in a community that was settled originally by German and Irish workers, rail workers, and agricultural workers, and we have just a lot of fair-skinned people here. So that combination really does kind of set you up, and there may be a component of vitamin D deficiency as well.
Mm-hmm. Dr. Worshel, you mentioned about vitamin D. I think that's important. I hear from my patients a lot that, well, I don't want to wear my sunscreen because then I may be deficient in vitamin D. Well, I think we need to squelch that in that we know that, first of all, you get the maximum amount of vitamin D with about 5 to 10 minutes max of sun exposure from the vitamin D production of your skin.
Is that a safe amount of exposure, 5 to 10 minutes? Without sunscreen on?
Well, what I usually tell my patients is that even with sunscreen, remember it is a screen, you still are getting some sun protection and production of vitamin D. But I think in this day and age also that if we're vitamin D deficient, then I think we have other alternatives to get that vitamin D, and that is through our diet or through, vitamin D3 vitamins that you can take. And so I wouldn't look to the sun to get our vitamin D levels we need.
And Dr. Gurley, are you seeing more skin cancers as well?
So I'm not the front line for skin cancers. Mm-hmm. My dermatology and primary care providers are.
So it's more advanced once you see a patient?
Correct, yeah. Usually when you get involved with an oncologist, the disease has penetrated through the first layers of the skin and usually has ended up in the lymph nodes or elsewhere in the body. And so that's when I usually see people. Fortunately, I don't see a lot of people with that advanced disease. I think we're doing a good job with our primary care doctors and our dermatologists on screening. I would like to get back on something you said earlier.
Absolutely.
You mentioned people ignoring the warning signs. And I think it's really important for people, especially if they have a spot on their skin they're not sure about, or something that's changing, to have it looked at. Because a lot of people don't know the warning signs for different skin diseases, and sometimes something can be quite large, and unfortunately, and I'm sure these other physicians can attest to that, we see disease that can be quite advanced, even on people's faces, that they've just ignored for years and years and years.
And they think it's just a simple rash, or
simple rash,
some rationalization
use some steroid cream on, yeah, all sorts of things that. And we don't completely understand why some people decide to ignore things and why some people get on things sooner. But some people just say, "Oh, that's been there; it hasn't changed much." But if you look at pictures, it's been changing over the years.
Mm-hmm. Let's talk about the signs of skin cancer. There are different kinds of skin cancers, and what to watch for. What should I be looking for?
If you have a lesion that is bleeding, scabbing, not healing, you should get that checked. Melanomas often are pigmented, and so you can have a mole that is changing. We try to educate patients on the A, B, C, D, E's of melanoma or of moles. So if there's asymmetry, A for asymmetry in a mole, if there are border irregularities, so if you have the borders of a mole with jagged edges, crooked edges rather than a round smooth edge. C is color. When there are different colors in a mole, very dark colors, that should get you concerned. D is diameter, so diameter of 6 millimeters, which is about the diameter of a pencil eraser. If it's bigger than that, we're going to pay more attention to it. And then E is very important. E stands for evolving. If a mole is evolving or changing in any way, if it's getting bigger, if it's getting darker, If the mole starts to become symptomatic, if it hurts, itches, bleeds, or scabs, those are signs that ought to bring you to the doctor to get the mole checked.
Mm-hmm. And then treatment required. What types of treatments are we talking about?
Well, the three main types of skin cancer are basal cell carcinoma and squamous cell carcinoma, which together are called non-melanoma skin cancers. And then, of course, the third one is melanoma. Depending on the size, the shape, and where they're at in the location, I would just say that in general, surgery, we want to get those off. And surgery is the usual first line of therapy for all skin cancers. The other thing about early identification is so important because, for instance, melanoma, if we can get the melanoma off early before it has spread into the lymph nodes and so on, then we can get on like a 98% cure rate and get rid of it early. So I would just like to stress the importance of identifying them, getting in early to get them checked and treated.
Mm-hmm. But most of the others can just simply be removed.
The other kinds of skin cancers, yes, there are, again, different types. It depends on the shape and size and how deep they've invaded in the skin. Basal cell skin cancer and squamous cell carcinoma are less, as a group, are less likely to invade into the lymph node systems or metastasize. And so they usually can just be treated with a superficial surgery and be done with it.
Mm-hmm. And when they do advance, it's serious, in fact, deadly in many cases.
It is, unfortunately. We know that many patients who have metastatic melanoma, the average prognosis, although improving over recent years, is somewhere between 10 and 18 months. That's how long people live on average. So we know that catching things early, preventing them before they've had a chance to spread, is definitely the best prevention.
Mm-hmm. And speaking of prevention, a lot of confusion about sunscreens and the type of protection we should use. Let's try and clear some of that out because there's a lot of information out there. What should we know about using sunscreens and the types that we should use?
Well, absolutely. I think that's an excellent question. And there is a lot of confusion. The numbering systems on sunscreens is the adaptation for the consumer of a laboratory testing system. And it really doesn't translate all that well, but we are stuck with that. That's what the FDA has deemed the rating system will be. So we have this SPF, which stands for sun protection factor. And then we have a number behind it. Classically, the number was an SPF of 15, so that supposedly would give you 15 times more of your natural protection. So that means if you were able to stay out in the sun for 15 minutes without burning, that you could then stay out 15 times longer than that 15 minutes. Unfortunately, I think what has happened is that the sunscreens have been thought of as like this perfect impenetrable shield. And so often we hear, especially with young people and especially with young women who want to get that golden tan, that they put on sunscreen all over their body and then they lay out in the sun for hours on end, and they may not be burning, but they're still absorbing ultraviolet light and they're still getting sun damage and they're still significantly increasing their risk of skin cancer. So really where I like to place sunscreens is they're in third place. So the first thing that you do is you avoid unnecessary sun. And that means scheduling your activities earlier in the morning or later in the afternoon, sitting in the shade instead of the sun, things like that, common sense behaviors. And number two is you wear clothing, protective clothing, appropriate to your activities. So that means you may wear a long sleeve t-shirt instead of a short sleeve t-shirt or tank top. And you might want to wear longer pants or more Bermuda kind of shorts, things like that. A hat and sunglasses. And so you protect your skin from the unnecessary exposure to the sun. And then in third place, you put sunscreen on for those areas that are exposed to the sun that are not covered by the clothing, that type of thing. So we have this SPF 15, which was the original sort of magic number, if you want to think of it that way, for sun protection. More recently, the Academy of Dermatology and the Skin Cancer Foundation have really emphasized moving that number up to an SPF 30. 30 is not twice as good as 15, but it's a little bit better. And that little bit, that incremental improvement, seems to make a big difference. So we recommend that you use a sunscreen, you apply it in the morning before going outdoors, that you reapply it every 2 to 3 hours while you're outdoors, because sunscreens get used up They get wiped off, they get rubbed off. If you're swimming or sweating, then they're washed off of your skin. And so you want to make sure you reapply that sunscreen on a regular basis.
Does a lotion or a spray, the type of sunscreen I use, make a difference?
Yeah, let me first just add that the SPF refers to the UVB blockage of a sunscreen. It doesn't necessarily tell you how good of a UVA blocker it is. UVB causes sunburns, UVB causes skin cancers, UVA causes wrinkling, tanning, and maybe more important in causing melanomas. And so you want to make sure that the sunscreen is labeled a broad spectrum sunscreen, which means in this country it contains either zinc, titanium, Parsol, or Mixoryl. Those are really the 4 ingredients that are allowed in this country that block UVA. Personally, I feel the lotions are better than sprays as far as the delivery vehicle. People who tend to spray tend to be in a hurry, and they do it in 30 seconds and they skip areas, and so we've seen sunburns through the spray. So if you use a spray, I would make sure you thoroughly rub it in, but my own preference would be for the lotions. One thing I should also add is that on the average, folks put on 2.5 times less than what's recommended in determining the SPF labeling. So if you're putting on a 15, the way most people put it on, you're probably really getting an SPF of about 6 or 7. If you want to truly get an SPF of 15, you probably want to go to an SPF of about 40 or 50 if you put the sunscreen on the way most people put it on, which is underdoing it.
So really lather it on.
Right.
And then wait, a recommended amount of time to wait before you actually go in the sun?
At least 20 minutes before you go out.
And are those areas of the body that tend to be more exposed the ones that are more susceptible to a skin cancer? The ears, the head, the back of the neck, that sort of thing?
Well, yes. In fact, 80% of skin cancers that we see happen on the face, the head and neck, and probably because it's exposed all year round. We're not covering up with clothing and winter coats and so on. It's still there getting sun exposure. And so, yeah, so most of my surgeries are facial surgeries with skin cancer.
We actually have an email that I want to get to from Margaret in Sandpoint. She says, are there toxins in sunscreen that will damage my child's skin? And this is one of those things that we've been hearing recently, I think mostly floating around the internet and that sort of thing, toxins in sunscreen, and people saying that they're going to avoid sunscreen. And what would be your reaction to that?
Well, there are several. First of all, there are 2 different ingredients in sunscreens. One is a chemical absorption kind of block that we use, and then another is a physical block, and that's what the zinc oxide, titanium dioxide are. And there have been some, I guess, people out there that are saying that ingredients can potentially be toxic. But when they say toxic, there's I guess one particular kind of ingredient is called oxybenzone, which has shown in laboratory settings on mice that there may be an estrogen effect on these mice. It never has shown to be true in humans at all. And frankly, if you had to equate the amount of oxybenzone they gave to these mice, people would have to put on a 6% concentration of this oxybenzone sunscreen for 270 years, so every day. So it really doesn't equate. So a lot of the studies, yes, they show that, and we've really looked at and scrutinized these sunscreen materials and ingredients very, very closely, and it just has not shown to show any toxic effect on humans. And then you got to also look at the flip side. Well, okay, what are you going to do? Use nothing? Well, then you're going to open up yourself to skin cancer, and we certainly don't want to do that either.
And I think that's the key is, everything in life has a risk, and could there be some minimal risk of sunscreen? Absolutely. Is that risk more than the risk of not using the sunscreen? We know that sunscreen works, in particular to prevent sun cancer. There was a study done in Sydney, Australia, where the people put on sham sunscreen versus real sunscreen, SPF 30 was what they used, and they reduced the melanoma rate by 50%. So we know that using the sunscreen actually works, and the risks outweigh the benefits. I think for Peggy, who emailed us, putting it on her child will probably give her more protection than any harm that it will cause.
Well, and we hear the statistic being that one bad sunburn as a child can increase your risk for a skin cancer later in life.
Absolutely. And nevertheless, I want to come back to that question because I think it's a very good, valid question, and it's a question that we get in our clinical practices on a regular basis. And in years, and Joel's answer was right on point. In years past, there were some ingredients, urocanic acid, some of the retinols that were placed in sunscreens that really didn't need to be there. And a good resource, a good place to check for that, the Environmental Working Group, EWG.com, has a whole section on sunscreens, and they address some of these concerns directly, and I think that's a good reference source, and that's one I refer my patients to.
Okay, we have a number of phone calls coming in that, Dr. Shu first.
I just want to add one last thing. I do tell moms who are concerned about chemicals in sunscreen that their child could use zinc oxide. Desitin that we put on babies' bottoms is 40% zinc oxide. And sunscreens have a low concentration. Sunscreens that use zinc oxide only have a fairly low concentration of zinc oxide. And that's going to be a very safe sunscreen if they have concern about other chemicals.
The old Lifeguard white nose zinc oxide. Yeah, I remember. We do have a number of phone calls coming in, so we want to get to those. Karen, thank you for waiting from 9 Mile Falls. You have a question?
Yes, I'm calling concerning wearing clothing to protect you from the sun. My dermatologist said that the rays, cancer-causing rays, can go right through clothing and also can go through windows. And so I'm wondering if I misunderstood or can get some clarification.
Absolutely. Thank you, Karen. Dr. Shu.
Yeah, a t-shirt that you wear, a regular t-shirt, has an SPF of about 6 or 7. You can get sun going through that. There is special sunscreen clothing with SPFs in the 30 to 50 range. UVB will be blocked by glass. UVA will not be blocked by glass. And so if you spend a long time at work or at home or in your car without a UVA block or filter put into the glass, you can get sun damage from the UVA.
I want to take an email now from Sue in Meade. She says, is skin cancer hereditary? Interesting. Is it?
There are certain types of skin cancers that can be hereditary. I think as far as the non-melanoma types of skin cancers, probably the biggest hereditary fact is that if your parents are redhead, fair skin, you are going to be redhead and fair skin probably. And so that in itself is a risk. And then, of course, as far as melanoma goes, there are familial types of melanoma that literally, if you have the familial type of genetic melanoma, that you have about 100% chance of getting melanoma sometime in your lifetime. So, yes, there are certain kinds that are genetic. The vast majority of the skin cancers we see, though, are not necessarily related to family types of cancers.
Okay. Well, when it comes to detecting and treating skin cancer, a Spokane man is on a mission. Jerry Ray hopes to reach 1,000 people this summer with a simple message to protect the skin you're in. Here's his story.
Jerry Ray's signature t-shirt makes him easy to spot.
Every place I go out away from my house, this is what I wear.
He's a walking billboard proclaiming a simple message.
Protect the skin you're in.
Jerry's battled skin cancer 3 times. The first bout at age 55 when he noticed a strange spot on his chest. Despite surgery, it didn't look good.
My skin doctor said if I were you, I'd go fishing because you may only have 2.5 years.
Jerry knows the importance of checking for melanoma and gets regular screenings, a habit started after the death of his secretary.
Her situation was the one that really hit home. Hello, sir.
About a year ago, Jerry started his one-man campaign to educate people about the dangers of skin cancer and the importance of protecting your skin.
Can I talk to you for just a minute?
We caught up with him at Rosar's, handing out information about skin cancer to anyone who would give him a minute.
I'm a 3-time survivor of skin cancer. I've had 3 surgeries.
His quiet style and message resonate with people wherever he goes.
If I were you, I would make an appointment. Several people actually wind up with tears if they have a family member with skin cancer, and it's really rewarding. I just love it.
Jerry's goal is to reach 1,000 people by the end of summer.
This is what I do to keep myself out of trouble.
Well, I think that's a great thing.
But it won't stop there.
As long as I can get out of bed and get my shirt on and get to town, even if I have to take a taxi cab, I'll be doing it. Stay healthy.
And the handout that Jerry gives to people is actually available online. We have posted a link to it on our website. Just go to ksps.org and click on Health Matters to get your own handout. And I bet you wish you had 1,000 Jerrys.
Yes, no doubt.
An advocate. And he's lived through it, so he knows. But so often it takes an incident before people will listen. We have a hard time reaching people on this topic.
Well, it seems that's true. Even if we're out there, you still go out to the beaches and you'll still see so many people out there just out laying out for the sole purpose of getting that deep, dark, rich tan, they say. But you got to remember there's no such thing as a healthy tan. Which I guess one thing is to, what about the tan and where does it fit in all this? Tan is actually your body's own desperate defense mechanism to protect itself from sun damage. It's the sun actually stimulates certain cells in our skin to produce this pigment called melanin that we see as tan. And so every time you see a tan, you know that some damage has already been done to your skin. So I guess that's one thing I'd like to make sure everyone knows about.
Well, we're talking about the sun, but also tanning beds. A lot of people are still using tanning beds even after all of the warnings.
Yeah, the most common cause of cancer death among young women in the United States is melanoma. And one reason is thought to be that they use tanning beds. And so we are absolutely against the use of tanning beds because the UVA rays are very important in causing melanoma. And when you go to a tanning parlor, most of the people you see are going to be women.
Okay.
And I think that's a very, very important point, is that the majority of tanning bed users, the vast majority, are women, typically young women, high school and college, women in their 20s. And they use the tanning beds not once or twice, but extensively. And every time, as Dr. Sears said, every time you see a tan, that's a cry for help from injured skin. That's a radiation burn is what that is, ultraviolet radiation. So getting that message across that tan skin is not beautiful skin, it is not healthy skin, it's damaged, injured skin. That is such an important message to get across to the viewers.
I think people don't understand that the UV rays actually damage DNA. I mean, that's how it works. The UV rays cause the DNA to fuse together in places it's not supposed to fuse together. And so when our body's trying to use that DNA blueprint, it tries to read that blueprint and it's all messed up because it's got all these fusions where they're not supposed to be fusions. It causes abnormal proteins, and that's what ultimately causes the cancer.
Yes, certainly something to consider. Sherry from Spokane with a question tonight. Good evening, Sherry.
Hi. I was wondering about expiration of sunscreens. I know a lot of people buy them in the summer and at the end of summer put them in the cabinet and 8 months later pull them back out. And how long before they expire?
Very good question, because I think I have some of those in my cupboard as well. I think we all do. There are expiration dates, I believe, on the can, but can we go past those dates at all?
So the expiration date is either going to be on the bottom of the canister or on the box, or it'll be imprinted into the bottom of the tube. What the expiration date does is that the FDA, which controls all of the sunscreen labeling and its strength and that, they give a date at which that sunscreen should have its full percentage protection. So we talk about an SPF 15 or an SPF 30. As it moves, much like food, as it moves beyond the expiration date, it begins to lose potency. I would say if you don't have any other sunscreen and your sunscreen is expired that you have, I would use it. But otherwise, I would get rid of it and I would get fresh sunscreen. And it's very important when you purchase sunscreen that you look at the expiration date. Different sunscreen formulations have different expirations or different degrees of shelf life.
So it's not as if it's going to hurt you, it's just not going to have the potency that it had.
Right. The July issue of Consumer Reports, they recommend that if you don't see the expiration date printed on the sunscreen, you just write the date in. And their recommendation is that it should be good for about 3 years. And I would say if you left it in your car where it gets 120, 130 degrees, I would probably not keep it that long.
Better safe than sorry for a couple bucks, certainly. Roxanne from, oh, I'm sorry, Dr. Sears.
I'd just like to add that in that same Consumer Reports edition, it showed that a lot of the mineral-based sunscreens, titanium and zinc oxides, and those are a lot of times found in the makeups, just the powder makeups you see, they don't really hold up to their advertised SPF levels. And so I think that we've got to be careful with some of the makeups that we see that say SPF 15. You've got to make sure, I would, again, increase that required SPF up to 30 or even above 50. So.
Okay, that's good advice as well, because a lot of us, our women, wear a moisturizer that perhaps has an SPF to it, and then our makeup as well. So we think we're getting all the protection we need.
Double protection.
Double protection. Roxanne here in Spokane. Good evening, Roxanne.
Good evening.
Thank you for waiting.
I'd like to hear you discuss atypical fibroxanthoma, which my husband was just diagnosed with.
Yeah. We call that, it's atypical fibroxanthoma, and that it's a lot easier to say AFX. And that is a type of skin cancer that happens usually in older individuals on sun-exposed areas, again, usually the scalp, the face, sometimes arms, wherever the sun has been exposed. We treat it very similar to a squamous cell skin cancer, and so the treatment is usually surgery. We want to do an excision of the cancer, get it out, and in most cases that's curative.
So it's just another type of skin cancer.
It is.
Then. Okay, very good. You know, we haven't even touched on the fact that not only, and Dr. Werschle, you briefly mentioned the damage that the sun can do when it comes to just aging and taking years off of people. If we could just convince the teenagers and the 20-somethings that this is going to benefit them in later life, but they're invincible. They just don't listen.
That's so true. And Dr. Hsu very clearly described how we have different kinds of ultraviolet light. We have this ultraviolet A, which we sometimes call the aging rays of the sun, and we have the ultraviolet B, which is the burning rays of the sun. And our sunscreens are only labeled for ultraviolet B. We don't have a labeling system for ultraviolet A. So even if you're a wise and smart consumer that does your research, when you go to purchase sunscreen, you can't really figure out how good that sunscreen is for the ultraviolet A or the aging rays of the sun, and that's also what's in tanning beds. So sometimes dermatologists, besides calling tanning beds cancer beds, we also call them wrinkle beds, and because they will promote aging of the skin. And so there's different metrics, different formulas and numbers that you'll hear used, but in aging skin, commonly dermatologists will quote that about 80% of the aging that you see on your facial skin is from the sun. It's smoking is a big contributor if you smoke. But it's not as much from stress or how you wash or dry your face or things like that. Mostly it's from sun. And the more fair-skinned you are, of course, the more likely you are to get that sun damage. So we all work very hard at protecting and educating patients on the risks of skin cancer and how to help reduce those risks of skin cancer. But the same things hold true for wrinkles and aging and liver spots and folds and creases and pretty much everything but gray hair.
Yeah, all of those fun things. We have Ellen in Red Deer. Hi, Ellen.
Hi.
Thank you for calling.
Yeah, thank you.
You have a question?
Yeah, I have a question. I am African descent. My husband, his skin color is really dark, and he likes the sun, so he sits in the sun when it's really, really hot, and I would just tell him, you know, put some protection. The fact that you have darker skin doesn't mean you cannot have damage, but he doesn't understand. So is there any, do darker skin people have more privilege than lighter skin?
That's a very good question, Ellen. Thank you so much. What can Ellen tell her husband?
Well, you know, the melanocytes that make our melanin, the skin pigment that we see in our skin, they do block and absorb the UV light, and it is protection. But it's not guaranteed. We see skin cancers in people from African descent as well as Caucasian descent. We do see it more commonly in Caucasian people because we have less melanin in our skin. But it's not a free pass. It's not a free pass. Still would recommend sunscreen for him.
So it's not uncommon then?
Right. I think as has been said that, yeah, certainly it is less common in darker complected people to have skin cancer. So yes, it does give you the natural protection. But again, we do find skin cancers sometimes in African descent people and darker.
Absolutely.
Hispanic.
And sometimes they're in places you ordinarily wouldn't think about looking, such as in the nail, the finger or toenail beds, or on the palms or soles. And because people with dark skin believe that they have more protection, and they do have more protection, then sometimes they don't pay as much attention to a spot that's changing, a pigmented streak in the nail, or the appearance of what looks like a new mole on the bottom of their foot, and they delay. We're back to where we started in the program. They delay in seeking care and attention for that concern, and that can actually cause a worse prognosis. So aging occurs no matter what your skin tone. Skin cancer can occur even in the darkest of dark skin.
Okay. Tanisha here in Spokane, good evening.
Hi, thank you for having me.
Absolutely.
I have a question about melanin. What is melanin used in the medical industry for? And I'm also very curious as to what is extracted, like how is melanin even made and then sold?
I wonder if it's melatonin?
Melatonin, Tanisha?
Yes. They say that a lot of African Americans, such as myself, we have a lot of it. And I'm thinking that's probably similar to the last caller where we don't think we need to wear sunscreen. And so I want to find out how is that used in the medical industry, and then where exactly does it come from?
Well, melanin is the naturally produced pigment that we see, which causes tan. Now, I am not sure of any product that actually has melanin in it that's available to purchase.
Commonly mistaken for melatonin, though, which we use for sleep.
Exactly.
Is a sleep aid.
Right. Okay. And so I think, that maybe is what you're thinking of, because I don't know of any melanin product that you...
No? Okay. I may be mistaken for melatonin then in this case.
Yeah.
In this case. Are there certain age groups that are more susceptible to skin cancers?
Yes, in general, skin cancer prevalence is increased the older we get. So we see more and more of, as you get older, for various reasons, we're going to see more skin cancer. One of those reasons is just because sun exposure is cumulative over time. Every time you're in the sun, you get a little dose of damage in the skin. Well, as you get older and you have more of those doses of damage, well, then it collects, and then the cells will eventually turn cancerous. And then also, as you age, there may be some alteration or weakening of immune systems that normally fight off the skin cancer cells before they have a chance to turn into a full-fledged cancer. And so, therefore, you can develop more skin cancers as we age.
Mm-hmm. How often should you have a full body check, and at what age should you start having full body checks?
I don't think there's a clear answer to that. It really depends on the individual. I think certainly if you have a lot of moles, if you have a strong family history of skin cancer, you need to at least get a baseline skin exam with a dermatologist, and they could determine the optimum frequency that you should be followed up. Certainly anyone who's had skin cancers needs to be seen regularly. We have certain protocols for melanoma patients, for patients who have had basal cell carcinomas and squamous cell carcinomas. I'm not sure that there's a standard recommendation as far as the pediatric population who and at what age they should have a screening exam.
Would it be important, though, for us to see our dermatologist as regularly as we see our general practitioner for a checkup, so to speak, on that sort of thing?
Well, I think Dr. Hsu's points are well taken, that it depends on the individual circumstances, the family history. It depends on how many moles you have. Sometimes we talk about people who have a high mole count or a low mole count, and the ones with more moles are more at risk. The best place to start is by doing your own self-skin exams and using material like we saw earlier in the story as guidelines to do your own self-skin exams, and parents certainly can check the children. And then if you have questions about certain spots that may be changing, and not every spot that changes is necessarily bad or cancerous, but if you have questions about that, that's a good time to start the dialogue with a visit to either your family doctor or your pediatrician, and then if they feel it's appropriate to go and refer you to the dermatologist or to visit the dermatologist. And certainly if you, as Dr. Hsu said, if you've had skin cancer, we have very well-described protocols by the American Cancer Society, the Skin Cancer Foundation, and the Academy of Dermatology, and I think we all practice in a same or very similar way on those protocols.
Okay.
In general, patients who've had a skin cancer at a minimum should be getting a full body skin exam twice a year. So those are people who've had melanoma skin cancer. Another way that you can get an exam and not really realize that you're getting an exam is when you're getting your hair cut. Your hairdresser, oddly enough, is getting a better look at your scalp than a lot of other people would, because they're moving your hair around, they're seeing different parts of your scalp. And if, feel free to tell your hairdresser, if you see a weird spot, let me know, because that could be the first person who might see it.
Yeah, that's an excellent point.
Yeah, I'm smiling
good
because
advice.
I do get several referrals from hairdressers and barbers for skin cancers, and so whenever I see them and they send me a patient, I make sure to give them a call and give them kudos to say thanks for watching.
Yeah,
and
very
paying
good.
attention.
Well, Pam here in Spokane. Hi, Pam.
Hello.
Do you have a question this evening?
I have a comment also. My mother had a skin cancer on her lip, and she treated it by herself, but it took me a long time to get her into a doctor, and it was cancer, and that was resected, and she did fine. But my question probably has to do with people looking at older people and making sure that they are, being watched, and if you notice anything, and get them to a doctor. Also, I'm prone to cold sores, and every now and then on my lip, I will get the tingling like I'm going to get a cold sore, but I don't get one. Is that something I should be paying more attention to?
Yeah, so we know a lot of cold sores are related to herpes simplex virus, and usually type 1. And what happens is all viruses that are herpes viruses, including the virus that causes chickenpox, gets into our nerves, and that's where it lives. And when our immune system, for one reason or another, like an acute illness like a cold, our immune system becomes slightly compromised, and the virus has a chance to reactivate. Because it's living in the nerves, it sends off signals into the nerves. So sometimes when people are getting that tingling sensation before a cold sore, it's actually the virus reactivating into the nerve before it makes any skin manifestations. That's a good time to start treatment if you're prone to cold sores.
And what type of treatment?
There's several over-the-counter products that you can buy that are marketed for that purpose. Sometimes we put people on oral antivirals, most commonly acyclovir, for some of our patients that have that kind of problem.
Okay.
I'd like to come back to the first part of Pam's question when she mentioned that her mother tried to treat the skin cancer on her lip by herself. And this is something that we see more and more. There are homeopathic type ingredients that are sold on the internet, and they go by various names, but a common one is black salve. And that doesn't represent one particular kind of treatment as much as it represents sort of a category of these non-FDA approved medications of various compounds, various chemicals, and people will sometimes, instead of having surgery or going to the doctor, they'll decide that they're going to treat it themselves with a black salve or something similar that they buy on the internet. And I strongly, strongly encourage them, number one, not to do that. And if they choose to do that, go and see your dermatologist and discuss that, because we're aware of these things and we can give you education and help you to hopefully make a healthier choice.
Can it make it worse?
Well, it can make it worse by virtue if it doesn't work and the cancer cells are still there. They just continue to grow and they go deeper and deeper. And once they penetrate through the skin and begin to spread, then it really is no longer so much the dermatologist who's going to treat it, usually surgically, but now it's the oncologist that comes into play. And that leads us to the different types of chemotherapies and biologic therapies and gene therapies and radiation therapy. So now you've moved from what is a relatively straightforward surgical procedure to a much more complex and usually longer period of therapy to try to treat not just the local cancer, but where it's spread to.
I'd like to piggyback on that comment, and even saying, you mentioned that she had her cancer on the lip. There are certain areas of the face that are higher risk areas, the lips, the eyelids, the nose, the ear. And we use a technique called Mohs surgery for those more aggressive types of surgeries, or areas where the tissue we need to spare as much tissue as possible, like the eyelid.
Very sensitive.
It's very sensitive, and Mohs surgery is really the gold standard as far as the highest cure rate, and we're able to get the cancers out with as small a hole as possible, and therefore optimizing the cosmetic result afterwards. If you have a smaller area to close or repair after surgery, then it would work out better. So just like to make sure that, there are different types of surgeries we use, and Mohs surgery is for the more complicated and difficult cancers.
Okay. Lindsay in Calgary. Good evening, Lindsay.
Hi. I wanted to know if there's still damage from the UV rays to the skin or the eyes if you're sitting in front of a window in a bright sunny day, but the sun isn't actually pouring in the window, but the light is still very bright and it's a very sunny. Are those UV rays still jumping around and coming in beside the window if you're right near it?
Like a reflected light.
Yeah, so like I said earlier, UVA does penetrate through glass, and even if you don't get sun directly coming through the glass, sun gets bounced off of water, sand, metal, snow, so the sun can be reflected through the window and can damage your skin. And that's, again, the UVA aging wavelength. You do have to be careful to protect yourself even if you're by a window.
So getting up in the morning and just making sure you're adding sunscreen to your morning routine, even if you're going to be in the home near a window.
Absolutely. And sometimes people don't believe us when we tell them these things. And I like to use the example that if you're on certain medications, certain antibiotics or certain types of blood pressure pills, or if you have certain medical conditions, there's a condition called lupus, you can develop horrible allergic reactions from the sun sitting inside your car or sitting inside your home behind the window where the light hits you. So that's sort of a proof positive that these rays are coming through and are continued to be dangerous.
And those are actually, so we're not even talking about skin cancers in those cases. Those are complicating other issues that you may have, like the lupus or allergic reactions. So other issues to consider with the sun.
In fact, a lot of these photosensitivity or autoimmune disorders are mediated by the longer UVA wavelengths that go through glass. You can have your windows treated either in your home or in your car, and have UV8 coating put on those windows. If you spend a lot of time at work or in the car by a window. So the windows can be treated to get complete or nearly complete UVA blockage.
Okay. Nancy here in Spokane. Good evening, Nancy.
Hello, and thank you for taking my call. I have skin cancer, and I went to the doctor last week, and I have like 8 spots on my face that they zap with the liquid nitrogen. But what I was surprised about, I also have it on my breast, which I've never had before. And one thing that, since you're educating people, I don't even know what kind of cancer it's called, so I'm going to call my doctor and ask that, and I thank you for that. But my concern is, does the cancer, skin cancer, turn into something where, like my sister had her breast removed, where she had to have radiation and everything else? Could skin cancer turn into that?
Yeah, so skin cancer, even if it spreads to other parts of the body, doesn't change the type of cancer it is. It's a common misperception that, when someone has breast cancer per se and it moves into the liver or the lungs or the bones, that now they have liver cancer or bone cancer. But what we know is when we take that cancer cell that's traveled to other parts of the body, it's still the same cancer as it was when it started. Unfortunately, I've known a number of people who had a melanoma removed 20, 30 years ago. They show up with stroke-like symptoms. We scan their head, and we find that they have a mass. The mass gets biopsied, and it's melanoma. And they said, oh yeah, I did have that mole removed 20 years ago. So it's still the same cancer, even though it's not in the same place. And so a skin cancer that you had on your chest or on your face won't change into breast cancer, but it will be, it can sometimes travel to other places, but still be the same type of cancer.
Mm-hmm. But she does need to contact her doctor because there's some confusion there about what type of cancer that she actually had and in dealing with that.
Yeah, I think probably what she has is something we call actinic keratoses, which is a precancerous lesion. And what they are, usually, again, on sun-exposed areas, the face, arms, wherever, the neck, it'll be little rough, scaly spots that just won't really go away. Sometimes they feel, you can feel them a lot of times. You don't actually see them necessarily. And those are precancerous lesions to squamous cell skin cancer. And those are the ones we typically would treat with liquid nitrogen. And what the liquid nitrogen does is just destroy those abnormal cells and then allows normal new skin cells to grow over and take its place.
It just freezes that spot off on the skin,
right.
Basically, takes it away. Is there recovery with that?
Yeah, with liquid nitrogen, as I said, it does cause a physical freezing, like a burn. Sometimes we call it a burn, but it's actually a freeze. So it destroys those cells. So it does get red and scabby and has to heal over. And but certainly is better than allowing that lesion to progress into skin cancer. So we like that as a good prevention.
We have Tom calling from BC. Hi, Tom.
Hi there. Yeah, I'm 78 years old. In 1988, I was had some sun damage on my scalp and on my ears, and the doctor prescribed a product called Effudex, and here I am in 2016, and a different doctor, but still prescribing Effudex, and it just seems to burn off a few layers of skin, and it goes away for a while, but it still comes back. Is there anything better that can be used?
Well, not surprisingly, we still use a lot of Effudex, which is the chemical 5-fluorouracil, usually abbreviated as 5-FU. And 5-FU, I think, well, actually, Dr. Gourley, it comes from your world, where it is an intravenous or oral cancer chemotherapeutic agent. And it was discovered many decades ago that patients who were being treated for other internal cancers, when they were treated with this drug, their precancerous spots that Dr. Sears was just describing, the actinic keratoses, they would turn red and peel off and get better. And so dermatologists took the medication and put it into a cream and started rubbing that on the skin, and that became Effudex. The challenge with the precancerous spots is that precancerous spots represent the first stage in the development of skin cancer. And that development of skin cancer is from years and years and decades of ultraviolet radiation causing genetic damage that Dr. Borley discussed. That ultraviolet damage then manifests itself as these rough and scaly spots and then eventually as skin cancer. And we're pretty good at treating the precancerous spots, and with Mohs surgery, we're excellent at treating skin cancer. But what we haven't quite figured out yet is the way to fix the genetic damage that causes it all in the first place. And that's where we're looking. So in my opinion, I think that Effudex and that molecule is a gold standard in therapy of precancerous lesions.
So he was wondering if there was anything else to use, but that seems to be the best option.
Well, there are some other treatment options for precancers. There's a cream called imiquimod, which is a cream that stimulates the immune system to get rid of the precancers. Another treatment which has become more popular is something called photodynamic therapy, where a drug, Levulin, is applied topically to the skin where there are precancer cells, and then the treated cells or the treated skin is exposed to blue light, which activates the drug, which causes killing of the precancer cells. And so depending on the individual, some individuals still respond best to the freezing with liquid nitrogen, some to 5-FU, the Effudex, some to the imiquimod, and some to photodynamic therapy. So it depends on the individual situation. And sometimes one treatment works for one individual better than another treatment.
Mm-hmm. Are there side effects to using that particular treatment that he was using?
The initials 5-FU sometimes are used in a different context, and patients will sometimes report that it feels like they stuck their face in a blast furnace or in a fire, and the side effects can be significant and severe. And Dr. She's absolutely correct. It just depends on the individual. There are many different treatments, but that was really the first one, and is still widely used.
Mm-hmm. So it's worth discussing with his doctor if there are other options then. It's something you should always do, to bring up that sort of thing with your doctor. We have just a few seconds left in the show tonight. And I know all of you are encouraging all of us to wear sunscreen, but some quick other advice that you might give us when it comes to our skin and just keeping it healthy and vibrant and disease-free.
Well, I guess I would say there are three things that I would consider regarding skin aging, not only skin cancer, but skin aging. And first on my list is going to be sunscreen. On anybody's list is going to be sunscreen. And then you might want to consider also a whole, what we call retinols or tretinoin or that sort of thing. It's a vitamin A derivative that we can apply to our skin that actually does help heal aged and sun-damaged skin. And then finally, a third, I guess, big family of creams would be something we call antioxidants, like a vitamin C cream and that sort of thing. And oxidants will take care of a lot of what we call free radicals, superoxides, that sort of thing that can be damaging to the skin. So I guess those are the three. Okay. Sunscreen,
very good.
Retinols, and antioxidants.
All right. Well, thank you all for being here. It was a very quick hour. I appreciate your time and all your advice this evening. And that will do it for this edition of Health Matters. A reminder that you can find links to a number of skin cancer resources on our website. That's ksps.org. I'm Teresa Lukens. Thanks so much for watching. We will be taking a break for the rest of the summer. Look for brand new Health Matters shows coming this fall.
Health Matters is made possible by our viewers, the friends of KSBS, and by Providence Healthcare.
I'm Dr. Andrew Boulay, and when my wife had a cardiac arrest, I chose Providence because I knew that everything we needed for her complex care was available, from the emergency room to radiology to the nursing staff to the specialists we needed for her care.
My name is Beth Perez, and I am a registered nurse, and I work at Holy Family Hospital on the labor and delivery unit. I'm about to have my second child, and I chose Providence because I love and trust the people that I work with, and why wouldn't I?